the baby has to come through a narrow canal, and if there are factors that are affecting the canal, then you may be advised to have a cesarean section. If your cervix, for instance, has been dilating very well, it usually starts from a closed position, that's 0 centimeters, and has to dilate to around 10 centimeters for the baby's head to fit in. Maybe you've been dilating well, you've gotten to around 6-7 centimeters, but the cervix has completely failed to dilate in spite of adequate contractions, and you're told that the baby's head is swollen, the baby is not doing very well, there is something called a caput, or the birth canal has become very dry, you may be advised to have a cesarean section because of that. Sometimes you may have a blockage of the, or an obstruction of the pathway. Maybe the placenta is completely obstructing or partially obstructing the pathway. You may be advised to have a cesarean section. That's a condition we call placenta previa. Or you have a tumor, for instance, a fibroid in the lower segment, or a tumor from the ovary that is obstructing the lower segment. Then sometimes you may be advised to have a cesarean section. Okay, so that's about passage. Or sometimes the bones around the pelvis are too narrow compared to the baby's head, what we call cephalopelvic disproportion, or they are inherently narrow, maybe because you're born with a disorder, or maybe you suffered from rickets, or you had a fracture and the healing was not okay. That's a contracted pelvis. That's another reason for cesarean section. Sometimes during labor, the placenta may just decide to separate very early and you start bleeding. That is called abruptio placenta or antepartum hemorrhage, and you may be advised to have an emergency cesarean section to save the baby's life and to have a good outcome for the baby.